So this afternoon, as part of our continuing series of webinars, uh, the title of this webinar is How to Bring Back Patients and Employees Safely. So today we have Dr. Jeffrey Coleman, who is a practicing dentist here in Southern California, and I have Mr. Frank Martinez, who is president of Strategic Clean. So Jeff, could you introduce yourself a little bit and give us a little bit of your background?
Sure, yeah. I grew up in Southern California here. I'm lucky enough to still be practicing and living here in Huntington Beach, and graduated from USC Dental School, and been practicing for about 10 years. My office is right here, and that's pretty much it.
Frank, give us a little bit of your background, if you don't mind.
Sure. So I've got about nearly 30 years experience in the environmental construction and real estate development arena. We started up Strategic Clean America last year, just after COVID was a thing. We took out the environmental services of our environmental company to attack the disinfection and decontamination services to help people come back to work safely. And the product that we use is called Monofoil. It's an EPA approved product that is wonderful at killing COVID-19. And that's been a very good lasting solution for us in helping folks such as Jeff and his company and others like him across the country.
All right, good. So let's go back and do a little history lesson. So COVID hits. Dr. Coleman, could you explain a little bit of the impacts that had on your practices, on your practice?
Yeah, when it first hit, we didn't know what was going on. Did we need to close? Could we stay open? How was this thing transmitted? Those were all questions up in the air. Ultimately, it came down. We ended up actually closing our office for 2.5 months, which, then you've got all the staff and employees wondering if they're going to be able to get a paycheck. And meanwhile, you still have overhead and rents and things like that. So it was a rather scary time, and we didn't know when we might be able to get back in the office.
Yeah, I understand. I mean, the world was definitely upside down. So fast forward, I don't know, what, a year and a half, whatever time frame, when you got the green light to reopen, could you go through what your concerns were in terms of how to bring back people safely and patients?
Yeah, absolutely. It was, I guess, kind of multifactorial, because not only was it bringing back the patients, but my staff was not real keen on coming back to work. I mean, obviously in the dental business, we're spreading germs. I mean, that's we do it all day, every day.
Yeah.
And so the staff was scared to work as well. Some of my staff's older, and they had legitimate concerns with transmission to themselves, and so and then likewise with the patients, we wanted to make sure that they were going to be safe and protected, and that we could protect from patient to patient, but also from patient to staff, and so there was a lot of hurdles, a lot of thinking, a lot of crying. It was difficult and confusing, for sure.
I can understand that. I mean, I confess, I don't want to go to the dentist on a good day, and you throw that on top of that, and I'm sure it's tough to be in your spot, because it's hard to know what the right thing to do is, right? So
yeah, and it got, because we were always open for emergencies, and in the beginning, it started out where you'd see, maybe 1 or 2 a week. And then just as time got on, it was just this onslaught of emergencies. There was almost no choice, but we had to open, because your teeth don't care that there's a pandemic going on.
That's a good way to put it. So I know that one of your considerations had to have been you wanted a clean environment. So
absolutely, yeah.
So enter Frank Martinez and Strategic Clean. So Frank, can you walk us through your thought process and your process for helping create that safe environment that we're all looking for?
Sure, sure. You know, and it's very topical right now. I just came back from a physical therapy appointment, and while I was laying on the table, I noticed that they were cleaning up on the tables after other people had left, but they were using the same rag that they had used on my table. So, and I think we're going to see a lot of that. And you know, one of the things that we brought on board with our process and our product is that it allows you to have a safe environment. We use what you call a mechanical kill versus a chemical kill on our process. So we use electrostatic process. So it forms a bond to the surfaces and it gives a longer lasting clean. And what that means is that we're able to allow up to 60 to 90 days of a clean environment. And what we do is we come back at the 45-day mark and retest to make sure it's still performing like we do. And what we do is we use an ATP meter and we swab the areas before we even do a treatment. And then we will come back and retest again to make sure that that worked. And if the numbers are above our threshold, we use 150 level. If it's above that, we'll retreat that area for free. The reason that's important is that we want people to have the comfort that they are going to be entering into a clean environment. You know, we're not saying you're going to have a completely sterile environment, but we're going to keep that enduring clean environment. You know, as Jeff was saying, they're in an area where you're going to have germs popping out. You know, whether you're a surgery center or just a regular GP office, you're going to have people that are coming in with colds and whatnot, or even COVID. And we give that extra layer of comfort. And we've had a lot of comments back from our clients, and it has really helped with employees and staff coming back and feeling at least more comfortable that that office has been certified of being clean.
Well, I think you should be proud of trying to comfort, because I talk to employers daily, and their number one problem is employees wanting to come back into the environment. My wife works for Costco and has for 30 years, and they have been continually short-staffed, and a percentage of their staff just says, I don't want to come back. There's too many people. It's unclean. So I think that's really neat. So Dr. Coleman, so tell me how Frank's process has helped your practice, if you could.
Yeah, absolutely. I mean, there's a multitude of things. I'll try and get to them all.
Yeah.
So I don't forget any, but you know, first it was the idea, you know, we've always been clean, as, you know, any medical office typically is. But having that meter was kind of eye-opening. I don't know if Frank remembers, but we actually used it in my break room, you know, the staff break room, and it came through at a crazy high number. And we like to think we're pretty darn clean. So that was kind of eye-opening. And then, you know, once we had it sprayed, it was nice to have the comfort to know that it was attaching to all surfaces. Because, you know, when you wipe things down, you might not get the underside of the, you know, the ledge of the counter or the backside of the computer, or, you know, places like that you just typically don't wipe down, and you're also typically not touching. However, the aerosols created from, you know, dentistry, they get to those areas. So I liked the aspect of the electrostatic, you know, adhesion to the different surfaces within my operatory. That was a big bonus for me. Combined with the fact that it did last, you know, the 90 days, and it holds up to, you know, our regular wiping. So it's not like we just spray this stuff and then we don't clean the room. We still clean the room just as much as we ever did. And so that was a concern that it might actually wear off, you know, because we are cleaning so much with wipes. And we do use disposable ones. We're not reusing the same rag, just FYI. But so the fact that it would hold up to that kind of rigorous cleaning for, you know, the 90 days was huge. On the patient side of things, or the retention or getting new patients type of thing, it was huge to be able to have that sticker on the front door. And when people ask, you know, hey, what is this? I could explain it to them, and they were put at ease, you know, that this, you know, not only does it, you know, help with COVID, which is obviously the reason why we did it, but other, you know, bacteria and viruses and things like that. So to be able to have that sticker and be able to make that claim was comforting to myself, comforting to patients, and to the staff.
Okay. So, Frank, tell us a little bit more about your process, if you don't mind. After that ringing endorsement, let's sum it up with how you can help. You know, give us a little
Sure.
more detail what your process looks like, and then we'll call it a day.
Sure. Well, first of all, Jeff, thanks for being full disclosure on the pathogen counts that we had. I was leaving that off the table. I do not want to pull up that tent from you on that one, but yeah, thanks for being full disclosure on that one. So, you know, kind of what Jeff was saying is how we work. So we use a double electrostatic process when we do the application. Preferably there's nobody in the facility when we're doing it, and we use a commercial grade, which is also hospital grade level of monofoil when we use it and come in and fog the environment that we're in. We'll swab it before, so we can get a baseline of what that is. We'll pick about 2 or 3 spots in a facility, and then we'll treat it, and then we'll come back about 10 or 15 minutes afterward and swab it again, check the readings, make sure that they are reading at the sufficient levels we want to. Typically, we're getting, I mean, we've gotten up in the thousands level of pathogens, and we get down, typically we like to see in the low double digits. And then we'll come back in about, like I said, the 30 or 45 day mark at the halfway point, re-swab it again. And we're typically still either in below 100 or somewhere around there after 34 or 45 day period. And most of our clients do a 1 or 2 year program with us. So that means we come in every 3 months and do that treatment. And we have many of our many of our clients will also have our clean wipes also, which has a lower grade of our solution on there, but it helps. It's more of a belt and suspenders solution to keeping the environment clean, and that's a good way to kind of keep it active in the facility.
Well, okay, so I like it. Anyone interested in more information, please reach out. I'm sure Frank is willing to help as many people as he can. And if I need a dentist, I would go to Dr. Coleman's office, because I know it's sterile or super clean or whatever you want. I don't know what the term is, but
especially the break room.
Yes.
Especially the break.
Yeah. You know, I did want to just mention one other thing that was real convenient too, was the application time was, I didn't have to shut the office down. They came in after hours. I think it took an hour roughly to get it done. And it was really convenient, seamless. Good. Well, I appreciate both of your time today. It's one of these aspects of COVID that you don't really think about, but you actually should think about it. So with that, I want to thank you both for your time today, and we will talk later. Thank you.
Okay,
Thank you.
Sounds good. Take care. Bye-bye.